there are many other drugs. As you know, pathophysiology is very complicated in MASLD because of diabetes, dyslipidemia, gut microbiome, genetic predisposition, diet, many things. So obviously we have many treatment options, and it's comprehensive. So most promising, we already have the resmetirom approved, obeticholic acid for MASH. FDA did not approve. That was late last year because of safety concerns. And then we'll have data on Ozempic, semaglutide, which is at the Wegovy dose. That is the dose for MASLD or MASH with F2, F3. That trial is ongoing. There is some preliminary data I'll show you. Lanifibranor is also in phase 3, and then the other two biologics. These are all once weekly injections that are associated with weight loss and improvement in liver steatohepatitis and fibrosis. Some improve steatohepatitis and fibrosis without weight loss. So if you have a patient who's non-obese and has steatohepatitis, so you can pick and choose which drug to use based on their metabolic profile. So this is the semaglutide trial based on which the current study is ongoing. This is semaglutide once a day. So the data is from once a day, but the phase 3 trial is with Wegovy at once a week. We do not expect it to be any different, if not a little bit better. But with once a day, they were able to show improvement in steatohepatitis. As you see bottom left, you see 60% improvement in steatohepatitis compared to 17% in the placebo. But this class of drugs have not been shown to improve fibrosis. So is 1 year too less of a time to show an improvement in fibrosis, or the fibrosis improvement that we saw with lifestyle modification is different from, weight loss from this drug? We don't know yet. Most people, key opinion leaders, believe that fibrosis should improve if the duration of the trial was longer. So we'll see. But if this drug improves metabolic profile, causes weight loss, improves steatohepatitis, but does not improve fibrosis, maybe time will come where we may have to do combination treatment with drugs that are shown to improve fibrosis and drugs that are shown to improve steatohepatitis. So it's going to be an exciting time where we may have to tailor the treatment based on patient profile rather than the ICD-10 diagnosis. Okay. So this is the lanifibranor. This is a study that showed that almost 45% resolution of NASH, 42% improvement in fibrosis, and the combined NASH and fibrosis improvement of 31%. This is once a day pill, but doesn't cause weight loss. So again, you have a lean MASLD MASH patient, maybe this is a good option. You have a patient who's afraid of taking injection once a week, maybe this is a good option. But if you have obese, diabetic, MASH, maybe, GLP-1 RA or even Manjaro may be a better option. So, and you have somebody who's not diabetic or diabetes fully under control, not on insulin, not obese, well, you have resmetirom. Or what if somebody is already on semaglutide? By the time they come to you, liver enzymes are still elevated, you have steatohepatitis. Yes, you can add on resmetirom to the semaglutide. So all sorts of combinations can happen depending upon what your patient needs. So this is the lanifibranor. There is no weight loss with this drug. There was one case of autoimmune hepatitis in the phase 3 trial. They had to hold the trial and they had to look at the case, and then they have restarted the trial enrollment. So this is what I was saying, you have to know where your patient is. If you have early fibrosis or no fibrosis, you would like to be safe, pursue lifestyle or medically supervised weight loss. If you have advanced fibrosis, you want to get a drug that has most anti-fibrotic effects. So phase 2 trial data, they are always a little bit higher numbers, very exciting. Safety may not be as much known, but always wait for the phase 3 data because you have a bigger sample size, more understanding of how it works and the safety aspects of it. And then it is vetted through FDA before we get to prescribe it. So those are some of the final thoughts. And these are the summary aspects of what I talked about. So this is an exciting time. NASH, MASH, nomenclature change, non-invasive testing, lifestyle intervention is integral to what we do. We have several options with regard to medically supervised weight loss, bariatric weight loss, and now we have the FDA-approved treatment that is targeted liver specific for F2, F3, steatohepatitis. Do not use it in cirrhosis, and seems like it is being covered by the payers without a biopsy. And as we are increasingly recognizing, we share patients a lot between our own parts. So a patient may see hepatology, medically supervised weight loss, or patient may come to pancreatobiliary with right upper quadrant pain, and they recognize that this is symptomatic hepatomegaly, hepatology referral. So a lot of interdisciplinary care that we provide at IU. So that, I think, may be the final slide. Thank you very much. I did not expect these many people to show up at 6:45, but I am impressed. Thank you very much for waking up and coming this morning.